day, everyone, and welcome to Engage Africa Foundation Festival 2022. The theme for this year's festival is Mobilizing for a Healthy Africa. And we'll be having an amazing panel discussion today. It's a really interesting one, and I think it's one that's close to my heart. This panel discussion will be on design and health in Africa. We have a guest who is really out in this field. So I'll start by introducing our guest, after which I'll introduce myself and my co-moderator. So our guest is Dr. Lambert Tata. He's going to be undertaking a PhD in public health modeling, and his work focuses on quantifying the health impact of policies beyond the health sector and interacting with policymakers to promote improved and active transportation infrastructures in African cities that can help mitigate health risk. Dr. Lambert, we're honored to have you here today.
Thank you very much, Agido. My pleasure to be here.
Yeah, thank you. My name is Usazeme Agedo, and I'm going to be one of the moderators for today's session. My co-moderator here is...
Hi, I'm Ione Choi.
Yes. So,
hi, Ione.
Hi.
Yeah. So today's going to be like a discussion, just an interactive session where our viewers or our listeners can actually learn and listen to recommendations so that they can easily put into action. So our first question today will be, Dr. Lambert, can you tell us or can you talk about a few major designs in Africa that intrigues you?
Yeah, that's a big question, but I think we can break it in terms of designing health in Africa in terms of the healthcare system and the other sectors that influence health. Now, if we focus only on the healthcare system, then we can understand that there are successes in Africa around healthcare systems that are working, and we have examples of good hospitals in different countries, but these are immediately plagued by so many shortcomings that it's more important to look at more the other sectors that do influence healthcare and improve our health. And by this, I'm looking at sectors that deal with prevention of health negative outcomes. And we would look at things like how things like digital health functioning in Africa. You would have good examples across African cities, African countries, like you have Rwanda is structuring or leveraging the use of digital health to improve its healthcare delivery. That doesn't sit quite inside healthcare in itself, but it's already something coming and supporting health at the same time. You would also look at designs around the prevention of non-communicable diseases, and you have a lot of effort around Africa that do try to promote health at different levels that do not necessarily feature at the healthcare system level. And I think there are all these examples that, without trying to highlight the good health facilities that we have in different countries that are already there and able to support our health, we need, I guess, when we want to hint or talk about health design in Africa, just immediately go to these other important sectors or that improve our health, which I've just mentioned. It could be our transport designs. It could be leveraging digital communication to improve healthcare delivery. It could be improving our diet systems and all these things that I would really feel important when we want to even discuss health at the base of it.
Okay, I think that's very interesting, the way you went into the aspect of the sectors instead of just the designs, but sectors that are working towards making these healthcare designs achievable. Um, Another follow-up question will be, what's the rationale behind your work? Like, what's the aim, the goal behind the work you do?
Again, it just sinks directly into what our problem is in terms of what are we trying to solve as health problems in Africa. We would see that our health systems are quote unquote weak and fragile. The fundings that go into healthcare systems are quite insufficient. And so it's almost at the end of the healthcare cycle. So someone is sick and would get to a health facility or healthcare system to get cured. And so this is already choked up in some ways because of our limitations. And so taking some steps back and trying to look at what generally improves health and well-being is an important starting point to say, if we try to make people healthier so that they don't have to face the weaker healthcare system to begin with, then we are already improving the health of the population. So what I do in my work is looking at different sectors, something like the transport sector, the agricultural sector, urban sectors, education, and trying to see what kinds of things are done in these sectors that influence health, and how can they be done differently so that at the end of the day, the population just somehow changes the way it does things, but then in a healthier way. So a good example would be if you travel, you went to work today, or however you did, you did within a system that is structured for you. You might have walked, you might have cycled, or you might have used a minibus to go to work. These things, you don't decide on them immediately. They are already embedded in a system, and to an extent, they are developed or designed by policy. And so if you were walking, you were already doing some physical activity, which in the long run improves your general well-being, reduces your risk of non-communicable diseases. If you were, for instance, using a motorcycle, your risk of road traffic injuries becomes higher depending on the settings and all these things. So the thinking is that if we start looking at these policies and trying to distill them into how they affect health, and even quantify these health impacts in the different policy sectors, we can look at the different scenarios that are going to promote health, benefit health for our population, and reduce the harms. And by so doing, we are already reducing maybe road traffic injuries, and then reducing those who would need health for injuries, healthcare for injuries in health facilities. That's broadly what I look at.
I think that it's really fascinating and interesting, because the way you said it or the way you tailored it, it's something that is really novel to me, and I'm sure it will be novel to most of our listeners, talking from the angle of not just cure, but prevention. So like prevention is better than cure. So how do we start working towards preventing it? What designs can we put in place? And myself as a sports professional, I can say it really resonates with me, because you talk about how you can develop physical activity also just to reduce the people going to the healthcare system, and also helping reduce the NCDCS. So I think it's really interesting. Thank you for sharing. So our next question will be, what would be your suggested approach to tackling well-being and social connection through the design of cities?
So I think one way to look at this, or my go-to approach, is more of engaging people in designing the cities they want. And there are, what I would say, good examples of how cities have been designed and how they they function, and there are also very bad examples. And what we would see mostly is that the tendency is to copy the bad examples, quote unquote. So our cities have some histories, and within this you have colonization, you have neo-colonization, you have, which have, you know, are within the fabric of the cities, and so in a way very difficult to change. But at the same time, we have the tendency to look at bad examples of cities and just add or model our cities in those directions. But the other way to look at this is that we have an opportunity in Africa that most of our cities are developing in situ. So this would mean populations in villages just expanding to levels that become cities and transiting from traditional agricultural approaches and then settling and growing quite fast. And these are the majority of towns and cities we are having in Africa. And so there is that unique opportunity to rethink together with the population, look at the bad examples, what we don't want to be, and look at the good examples of what we want to be, how we want our cities to be built with the people's consent, you know, these dialogues to and fro to reach maybe what I would say, bringing people to see the good side of how when we build cities in ways that are walkable, in ways that people can have green spaces around them, in ways that can reduce crime waves, in ways that can reduce informal settlements and all the negative things that it brings. When people are involved in these designs and nudged to cities that perform in these directions, I think we would already be doing ourselves a service when it comes to thinking of how we would want our future cities to look like. So in essence, what I'm saying is that the tendency is we are keen to copy the bad examples of old cities. And there are some, and not necessary to mention them, there are some good examples that are especially the South-South examples of how cities are getting structured, how communities are getting engaged in these designs, that we should focus on and capitalize on the fact that our cities are young. They have their histories, but they are not yet overly built in a way that it will be difficult to destroy and reconstruct. We have almost a clean slate on which we can think and design cities in ways that are helpful and are beneficial to our populations.
Okay, thank you very much for that response. And what I go for that response is you saying that there's hope for Africa. That since
Perfectly
we are just,
so. Yeah.
Since we are just, okay, you want to add to it?
Yeah. I think it's a way to notch that or hone that bit, that there is hope if we have this discussion of the kind of cities we want and move towards looking at the parameters of cities that would be helpful. And there are good examples that we are copying, and there are already initiatives into this. I think it'd be unfair to not mention the so many initiatives that are looking at how to improve cities and build cities in ways that are livable in Africa. But
before you, let me just interrupt you, before you mention the initiative, because we have another question that may target that. So before you mention it, let me just, So you saying that there is hope for Africa since we are just developing from rural to urban. So there's an opportunity for us to decide the kind of cities we want to see. I see that as like there's joy in my heart. I'm like, okay, yes, there's a hope for us. You also talked on my follow-up question, because I wanted to ask you about what role the public can play. And you talked about through dialogues, people having they can dialogue and decide how people can have green spaces. But I want you to talk more on that, like more practical ways that youths in Africa or members of the public can play in achieving this. Practical ways, like more part. I want you to talk a bit more on that.
So it's coming from an academic background, it's but fair to say that it easily trickles down from, or when we can share evidence with people, it's already a starting point. But from a practical side, we have non-governmental organizations that are usually stakeholders into promoting youth engagement, the stakeholders that take cities as their properties, interest in city development, who can, by advocacy of what the cities should be like, by looking for channels to voice the kind of concerns they have about cities, already are starting points. And there are no shortage of these in our settings. It's just the kind of things that they get involved and engaged with might not be towards cities. But in terms of what would change, I think the things like the tendency towards unplanned urbanization or building are things that people should have. The local governments try to do this in ways that they try to allocate plots for buildings and things like that, but these are not always maintained. So you would have instances where buildings just grow in different areas. When people are keen and are already aware of the kind of cities that they want, then these are things that they need to fight to stand up for, so that cities are more or less planned. The ones that have been built can be restructured because it doesn't take much, but practically it would need youth, it would need members of the public through activism, through engagement with local authorities and trying to understand where their cities are going, and also not support the kind of lax development where city authorities just leave things to happen in the ways that they happen, and then we have to deal with the mess that we are dealing with. I should say it's a complex one, but already thinking where we want to go, already having the civil organizations and already having different society groups interested in our futures in cities is, I think, a good entry point. And it would also mean that there is a lot of talking to the public that needs to be done, as for instance, this platform that you already sharing, that there is, while there are structures to ensure that we live better, we also have the responsibility to hold these structures accountable and direct them and in directions that would be beneficial for us and for our future. So that's how I see it ending.
Thank you very much for that also. I like your last word where you say we have, even though they are structures, but we have the responsibility of holding the structures responsible. I think that's a key point for us. Thank you.
Yeah, I think you touched on your previous answer, but so in recent years, we have seen youth in Africa collectively work together for social action in different areas. For example, the Nigeria's permanent voters card drive. So what kind of role do you think the young people, the next generation, can play in the design of cities for health? So you did say a bit about the youth engagement, so do you think you can add on to this?
Yes, the one on electoral cards was quite fascinating, and I think that is in fact where we should be coming from. I felt quite happy seeing that happen, and like, oh, this is something. It means we are up to something. And I think it would be more of the same approach. It took time before it reached where it reached, because people increasingly became aware of who is managing their affairs and in what directions they want things to be. It's a journey. And so if we who already care about these things, it's first of all our responsibility to bring this awareness to the population. And when that awareness reaches a tipping point, then we would have a critical number of people acting in ways or asking and pushing for changes that are necessary for our cities. So personally, I would feel that it needs a lot of advocacy from the smaller groups that see this as a problem, to sell this message clearly to the youth and make this as clear as possible that this is something that has direct effect to the youth in all ways possible. A green city does have huge benefits to our health today and tomorrow. How we build our cities does have huge benefits on us, both health and in every aspect, today and tomorrow. And when we succeed to advocate or to bring the impact of our actions or the actions of the leaders or authorities closer to the youth and to the population to see clearly how these actions are linked to impact, I think we would easily reach a tipping point. I guess it also works same with other things. Climate change took its time before it started having mass movement behind it and other, and this involves everyone. And so there's a lot of work that needs to be done at the background. Otherwise, I think people wouldn't come to that awareness that it is my responsibility to build a city that works for me today and for the next generations to come. And until that happens, we might just be waiting on some form of luck, in my view.
Yeah, I agree with you. Spreading like awareness and spreading like that education, like accurate information is very important. Do you have like an example of youth participation in healthy design in African cities?
So they're not coming to mind immediately, but there are in part of what we call the global diet and activity research. This doesn't look into city design itself, but the design of environments in ways that are healthy, where the project goes to engage school youths and bring them on board on exploring their environment, looking how healthy these environments are toward their food, their diet, and physical activity. And this is quite an important stage to engage the youth as well. It's early enough. It's building awareness at an early stage. And so when energies are coming in later in life, they are channeled towards the right direction. What I am aware of course, is other movements that would take place, though they do include youth from time to time around air quality movements in cities. But I wouldn't pin my finger immediately on something doesn't come to mind immediately. But there are many of these that I'm just aware of that are going on at the background in our settings.
Yeah, it is quite hard to come up with an example on the spot. How do you think that African cities can be designed to foster the well-being and participation of minority groups, for example, people with disabilities?
Yeah, I think this is a very big one, because the way, in my little experience living in communities, how we view and interact with disability is already a big challenge, talk less of. So there is a lot that needs to be done around embracing minority and especially people with disability. Just generally, contextually, I feel, before even looking at specific designs that optimize or enable people with disability or the minority to function well in our cities. So first thing is even acceptance to begin with. How do we get to, are we accepting that these are normal people and deserve the society's support to be able to thrive and function well? There is a lot of work that needs to go with that. Both, mostly now, it's families dealing with their troubles, and you can understand how limited that is. At the society level, there is need for this acceptance and society support. And then beyond that, we could, if we want to talk about specifics around design of environment in terms of how do we enable people with disability to be able to function to close to independently, how we design our roads, how we design our playgrounds for children, how we design our schools to integrate and incorporate people with disabilities of different forms, how the different minorities are portrayed, how we happen to be quite diverse in many countries. Ethnicities come up in different ways. They are part of our politics. They are part of our lives in ways that sometimes are beneficial, sometimes are quite harmful. And I do feel that beyond things that we can do, that some of which I just stated, there is an underlying problem that needs a society's action to embrace ethnicity, minority, disability as a component that makes us stronger, and then go next to try and see how we enable our environment in all forms as a society to make everyone be able to function. And this goes to equity. People are not the same at different times of their lives, but what are we doing to enable people to be able to function well? And I guess, I mean, it sounds like a sad one for me, because when I cast my mind back at how disability is handled, and yeah, I think there's just a lot to do. Maybe as your question comes, what could we do at the level of the city, or the level of, can be a starting point as well, yeah, to say that if we start acknowledging by the ways we design our cities, design our environments, making available crossing and parkings for people with disability to begin with. There are just so many areas where these don't exist. Is already maybe a soft message that is sending of acceptability. Maybe that's also an entry point. I might have looked at it more from society just accepting, but I while speaking, I did see how just doing the necessary infrastructural changes could change perception and maybe lead to positive how people are viewed and how they are embraced in their own societies and communities.
Yeah, I really liked how you said acceptance, just because attitude towards those people is very important, and is a lot of like stigma around people with disabilities, like just everywhere in today's society. Do you have an example of such an initiative through your work? Or?
Not that directly, but it's it's, I mean, looking at something that, although my work at the end just discourages how much infrastructure is built towards driving, how car-centric our cities are developing. But you would just see, if you look at many parking lots in Africa, in many cities that I've had to look at, how much of what space is allowed for people with disabilities. In fact, if there are even, to begin with, how many people do you even see with disability on daily basis out and trying to live their life? It seems like not many. And the question is, where are they? Has our society succeeded to suppress them to some corners so that they are not even seen? Or are we failing? Because if you go to one easy test would be, if you go to the city center or to a supermarket, and then you see people and you see these different people that are in the society, minorities, disability, and things like that. Okay, they must have gotten there, but in some way there is some level of acceptance. But then if you go to a supermarket, a mall, and then a section of people are not there, you can start tracking back. Is it that they don't exist in the society? Is it that something has been done so that they are not even at that level? Is it? So I guess these are the thinkings that, when, at least maybe from looking at transport systems and organizations of transport, that when you don't see markings for people with disability, people who are blind, people who can who have maybe movement problems and the rest, you don't even see parkings designed for them and all those things. At least, even if those were the right things to do, if you don't see these things, you already question how inclusive designs are and things like that. So I wouldn't be able to give some very direct, but these are more indirect ways of, when I look at how equal the equity dimension of transport, these are questions that come up and they need answers, and these would come from engaging with local authorities around their designs, and it's easier to focus on the majority and then ignore the minority, because unless someone speaks out and raises this and makes it the point, that so kind of thing.
Yeah, I think all the designs all come down to like acceptance and the good attitude towards them, so that they don't feel like neglected. But health in general, I think it's like an essential topic. And most recently, we can also be proud of the recognition of mental health, especially in some African countries such as the Nigeria, where mental awareness campaigns, programs, and advocacy projects have increased. Can you speak more about how to design for improved mental health?
So I would start with a little, my entry point would be maybe in Cameroon, where I got some initial experience around systems moving towards embracing mental health, and this is something that maybe the WHO has hinted on, and the infrastructure or the system in place is quite far from engaging and delivering mental health. So I would have been in Cameroon at some point in 2018, where it was, we're trying to map the mental health services and that are available in the country, and you would imagine how difficult it would be in regions of maybe 5 million people. You don't even, you barely have a mental nurse as just as one to whom and this does not mean people are not making effort, but the time, this is 2018, for instance, the time at which this is brought to is highlighted as something important. You can see how difficult it is. By and large, I'm saying that in such a mapping and trying to scan through what is available in terms of healthcare services for people for mental health, it's quite sparse, I would feel. But as you said, there are initiatives that are sprouted in different African countries trying to pin and make this an important issue. I do feel that irrespective of these initiatives, it still needs a lot of work, because mental health on its own does seem like everything. It does affect physical health. It does affect social and economic. So put together, there are huge consequences. And when you look at the economic and social cost of this is quite huge. You take a country like England, it's in the neighborhoods of 105 billion per year of only social and economic cost of mental health. So talk less of our system, healthcare system, where this there is just so much, this has not had the priority that it deserves. I would feel that there is just so much that needs doing, but to say the initiatives that are sprouting are worth commending and supporting, I think. Yeah, but there's just a lot to do there.
Yeah, I agree. There's like a lot of work, and like the journey is going to be a really long one, just because mental health is a very big and complex topic. There's a lot of factors involved and like other aspects. What is the connection how places are designed and health, particularly like non-communicable diseases?
Yeah, so this I might have hinted at the start, but it's just everything, I would say. Is you can start from the green spaces that you have around you. When places are designed to have all these green spaces, it's been shown to reduce stress, to reduce depression, to reduce all sorts of mental health illnesses, at least where these studies exist, because we still have huge gaps in our settings, but they are more or less empirical findings and should hold for most settings. Now you have other, you have non-communicable diseases like you have cardiovascular diseases, diseases that affect the heart and its vessels. You have diseases that affect like diabetes, that are lifestyle related. You have chronic respiratory diseases. When you look at how an environment is designed, we can start from, does it encourage people to be physically active or not? And if it does encourage physical activity, for instance, as green spaces would do, as roads with pedestrian paths would do, with cycling paths would do, then we are in other ways saying that people are getting physically active, and that is making them generally healthy, and that is reducing their risk of cardiovascular, of these heart and vascular diseases and other mental health illnesses. When we look at how the kind of vehicles we use in our cities, it's an unwritten rule that most vehicles in African cities are second-handed vehicles. Just 1% or so are bought as new vehicles. And so these vehicles, their performance in terms of air pollution and things like that are already, if these are taken care of, then we, in our cities, we are in a way saying that we want to live in cleaner cities in terms of air pollution, which means that there are a lot of chronic respiratory diseases that result from air pollution. And if you improve air pollution, you're already improving that, as well as other diseases of the heart and the vessels that are a result of air pollution. You have noise pollution. Our cities are quite noisy. How are we structuring that? They also have bearings on non-communicable diseases, still heart, vessels, and the nervous system. And so it to an extent, well, injuries, road traffic injuries might not fall squarely into non-communicable disease, but you see the breadth of disability that can result from road traffic injuries. And so Africa is dubbed as the world's capital of road traffic injuries and things like that. And these things, most of these come from how behavior and the kinds of vehicles we use, motorcycles, have a higher risk of road traffic injuries, and then the disability that result from. Put together, it starts ringing that if we were to take a moment and rethink of how our cities influence our health, and then try to structure things in ways that help improve health, and especially from non-communicable disease angle, and reduce harms, it does seem like we would have done ourselves a huge service in terms of non-communicable diseases. Of course, there are now things when you come to communicable diseases are also mitigated in some ways by how we structure our transport. COVID came and shut down our transport system. How are we structuring that as well so that we are even healthy? So in essence, in a village, it would be different because people can decide interaction or not. But in cities, this is a different story. You have to get to somewhere to get something, and how we design this just affects us in every way. And non-communicable diseases, which are now gaining so much grounds in our setting, especially the low and middle income settings, is something to really worry about. And how the cities are designed do influence how people feed. As far as that, and diet is already something that there's already a transition from local diet to more Western diets, and some unhealthy components are inherited easily, and so it turns and boils down to how do we design these cities to make them healthy. And there's just everything that when you split out, you would see that by designing our cities in thoughtful ways and using models that are geared towards producing health and reducing harms, engaging with populations and stakeholders that matter, we might reach at cities and continuously improve cities in ways that are very helpful in terms of most health dimensions, not only non-communicable diseases.
Yeah, for me, I really admire the study design just because there are a lot of things you need to consider and concern, like mental health and like the well-being. There's just so many things to put into effort into when you design the cities. So now I'm gonna pass it on to Osaze for her final few questions.
Okay, Rosalamba, it's like just listening to you, it has been really insightful and a lot of key takeaways and learning. I just want to ask you one question before I ask my final question. You talked a lot about TVC and how there are a lot of non-profits working in this space. So currently the way climate change is a major issue, and people are taking action, and people are also aspiring and encouraging it. This should be added to the curriculum of students in schools. I want to ask, what are your thoughts around that? Like this aspect of designing cities, do you see it's an essential topic for it to be included in even the student curriculum? Because I think also letting people know this for early stages, it's really important. And also, can you list some non-profits that are working in this sector that people can actually go to their site and learn more or read more on this?
Okay, thank you very much, Osasima. It might sound biased because this is where I work and I see life mainly from this angle. But if I were to try to be objective as to the importance of city designs, or design of environment as a component of schools of studies, I would feel that it is so central to curriculum designs, and even at a very early stage, so that pupils become aware of how their environment impact them and how they impact their environment. Now, I think it is just so difficult to see how you want to leave such a critical thing to only deal with at the level of advocacy. It has to do with people thinking about new ways of living, and innovative ways of structuring their environment. And I feel there is very little that would beat this as a school curriculum, as a core thing. People should play with their designs and look at how to structure their cities in ways that are helpful. So I think it's more overwhelming to look reasons why not to, if there are any, than to ask if it is essential. To me, just like climate change and even more, they have different impacts, but more important is getting people and pupils and students at very early stages to deal with this as an immediate problem, and innovative ways of living in the environment. This is going to be a continuous thing. It is not a one-off thing. And so there is just that need to incorporate it in our educational system so that it has the attention that it deserves and gets maybe the best output. Because as I just discussed, it seems to be the most central thing. As you can think about systems and think about things, the cities seem, are the most central thing that does determine your health in certain ways. It would have been considered in the past centuries ago as the heartbeat of industrialization. But today, it would be that single most important thing that would determine your health and well-being. And if something is that important, then I think things should be built around it rather than even kept as a peripheral thing. Now, to initiatives that are working in African settings, I think it would have done us more favor if I had taken some time to list this. I am not very good with having these things up in mind, but there are, for those that are more maybe youth focused, I wouldn't have them in mind. I think Choi asked that a moment ago, but for instance, there will be things like C40 cities that are like umbrella ones that are bringing cities together. I am aware of the for instance, a branch in the Lagos local authority that kinds of oversee how cities are structured, to which people would approach. But more importantly, I think if people would just take the time to browse these out, I think there are just many of them, but it's what to do with them when you are engaging with these initiatives and activities. It would be engaging and liaising with the local government authorities who are in the first, who would be using or implementing this. So everyone has access to a local government authority in one way or the other. And so it would be more of looking back at what initiatives are local. There is the Engage Africa, as we already starting to talk around, looking around youth engagement more importantly, where important things are shared like this. And then, liaising the kind of knowledges that are shared here and trying to link and knock at the doors of the local councils, the municipalities, and see what, if there are thoughts around city designs, what they look like, what we like about them, what we don't like about these, and what are we going to do about this. So I would have more examples of specific cities that I've been in contact with, like the Accra metropolitan city, what they are doing, what their plans are, and then you have that of Kisumu in Kenya, what they are doing, what their plans are, and you see they are quite open, people happy to receive the population, to engage with others who are interested, and everyone should be interested. So I do feel more that there are just many of these initiatives, and it needs people to take just some steps. Maybe you have some offhand there that you can share for the listeners, but that people can initially engage with, and then that would provide a platform for or a source of information for engaging with the local authorities. Yeah.
Okay, thank you so much for that. Yes, we try maybe do research and when post add it to this post. Thank you so much. Our last question, we're just trying to end it on a fun note. So our last question will be, if you can just list your 3 best. I know you've mentioned Rwanda and you have talked about the sectors. So Rwanda, yeah, okay. Can you also mention like 2 other cities or 2 other places in Africa that, from the lens of healthy design, that are actually putting in work currently, and at least if they are doing ranking, this guys will be the top? I know you've mentioned Rwanda. Which other 2 other cities or 2 other countries you think are already working towards this in Africa?
Okay. One city that has attracted attention most recently is Accra in Ghana. I just mentioned it a couple of, a few moments ago. Accra has been doing a lot in terms of its engaging with others and trying to open up its plan and look at how to improve it. The Accra Metropolitan Assembly, I see them engaging quite a lot, and the changes they are bringing are quite, significant. And I think that alone is a good example and a good stopping point, at least from a city structuring and city design perspective. Cities that are healthy and initiatives that are ongoing in that city. I do like it a lot. And so now a next city would be, I do like, there's a city in the west of Kenya. It's called Kisumu. it's a smaller city, but I do feel that it's quite on the right footing. It does have the right, I would say, stakeholders in place, the engagement with the stakeholders, which in a way seems like it's on the right footing. It changes into the kind of thinking about the transport modes, thinking about the structuring of the city in ways that serve the population. There's also Kampala in Uganda that I do like their initiative, mostly at least from their thinkings around the transport aspect. I mean, there are changes, I would say, that I've been following changes and things happening in Lagos that I quite like. But Lagos is so big that when things happen there, you don't know to what scale. It's difficult as outside to know to what scale that has changed. But I do follow a lot and many changes that are happening in Lagos. Indications already that is something that you would want for a city like that accommodates many people. The thinkings and the things you see coming out from there, there is still a lot to be done, at least because of the population. But then, of course, there are Southern African cities like Cape Town that are already, I guess, those are already good examples of to an extent. But what I do feel is since my idea is looking at cities that are just, they are developing in situ, you would have learn more from these other cities that I've mentioned. They have a lot of they have good examples that you would that it would be nice to look at what is going in those cities and in ways see how we copy and improve them in different other cities. Yeah.
Okay, thank you very much, Dr. Lambert. For me, it has been a really interesting session and a lot of learning. I don't know if you have a short charge or a very short charge because of time. I don't know if you have anyone, a short charge or a short statement before we wrap up, or you're good?
I just want to thank you for this platform, first of all, and I just want to echo again in a very short way that cities, designs, and the different sectors that are involved are quite important in achieving health for a population. And that when we talking health, we should, especially in our systems where the health systems are weak, underfunded, and in precarious context, we might think as much as possible as looking at the different frameworks that direct our lives, the policies and the rest, and try to see if we can harness help from these sectors. I guess that's what I would like us to take home, rather than only focus on the end of the cycle of changing health once people become ill. But again, I'm very, very grateful and thankful to both of you for having me on the platform, and that I support the work that Engage Africa is doing a lot. And so thanks.
Thank you so much. It's been a pleasure talking with you, Dr. Lambert. I'm sure our guests, we have so much to learn. And for my co-moderator.
Yeah, I just wanted to say thank you so much. It was an honor talking to you, and I learned a lot.
Okay, so bye. Thank you.
Bye. Thanks.